miscarriage? Well, it is the spontaneous loss of a pregnancy before the 20th week. About 10 to 20% of known pregnancies end in miscarriage, but the actual number is likely higher because many miscarriages occur very early in pregnancy before you might even know about a pregnancy. Well, the term miscarriage might suggest that something went wrong in the carrying of the pregnancy, but this is rarely true. Most miscarriages occur because the fetus is not developing as expected. Miscarriage is a relatively common experience, but that doesn't make it any easier. Take a step towards emotional healing by understanding what can cause a miscarriage, what increases the risk, and what medical care might be needed. Earlier on this channel, I have already posted a short video about miscarriage. If you are regularly visiting my channel, you must have seen playlists. Okay, so in English medical short video playlist, that video is already posted, and today I am going to discuss the miscarriage in detail. First of all, let me tell you the symptoms. Well, most miscarriages occur before the 12th week of pregnancy. Signs and symptoms of a miscarriage might include vaginal spotting or bleeding, pain or cramping in your abdomen or lower back, fluid or tissue passing from your vagina. If you have passed fetal tissue from your vagina, place it in a clear container and bring it to your healthcare provider's office or the hospital for analysis. Most women who have vaginal spotting or bleeding in the first trimester go on to have successful pregnancies. Now I'll tell you the causes. Okay. What causes the miscarriage. The first thing we should note is that there might be problems with the genes or chromosomes. Okay, most miscarriages occur because the fetus is not developing as expected. About 50% of miscarriages are associated with the extra or missing chromosomes. Most often chromosome problems result from errors that occur by chance as the embryo divides and grows, not problems inherited from the parents. Chromosomal problems might lead to blighted ovum. Blighted ovum occurs when no embryo forms. Intrauterine fetal demise. In this situation, an embryo forms but stops developing and dies before any symptoms of pregnancy loss occur. Molar pregnancy and partial molar pregnancy. With a molar pregnancy, both sets of chromosomes come from the father. A molar pregnancy is associated with abnormal growth of the placenta. There is usually no fetal development. A partial molar pregnancy occurs when the mother chromosome remain but the father provides two sets of chromosomes. A partial molar pregnancy is usually associated with abnormalities of the placenta and an abnormal fetus. Molar and partial molar pregnancies are not viable pregnancies. Molar and partial molar pregnancies can sometimes be associated with cancerous changes of the placenta. And also there are some maternal health conditions that can lead to miscarriage. In a few cases, a mother's health condition might lead to miscarriage. Examples include uncontrolled diabetes. Also, if there is any infection that can lead to miscarriage, hormonal problems, uterus or cervix problems, thyroid disease can also lead to miscarriage. Okay. Now I'll tell you some conditions. There are some misconceptions about miscarriage. These things which I'm going to tell you do not provoke a miscarriage. Okay. First is exercise, and that includes high intensity activities such as jogging and cycling. Sexual intercourse. Some women have a wrong concept in their mind that sexual intercourse may be dangerous in pregnancy, but this is far from the truth. Okay, so there is no prohibition in sexual intercourse. You can do it. Okay. Also working for, provided you are not exposed to harmful chemical or radiation. If you are not working in an industry where there are chemical radiation, there is no risk to pregnancy if you are working in a clean environment. Okay. Also, you should talk with your doctor if you are concerned about work related risks. Now I'll tell you the risk factors. Various factors increase the risk of miscarriage, that include age. Women older than age 35 have a higher risk of miscarriage than do younger women. At age 35, you have about a 20% risk. At age 40, the risk is about 40%. And at age 45, it is about 80%. Okay. So the more you age, the higher the risk of miscarriage. Okay. Also, if there is any history of previous miscarriage, Women who have had two or more consecutive miscarriages are at higher risk of miscarriage. Chronic conditions. Women who have a chronic condition such as uncontrolled diabetes have a high risk of miscarriage. Uterine or cervical problems. Certain uterine conditions or weak cervical tissues, incompetent cervix, might increase the risk of miscarriage. Smoking, alcohol, and illicit drugs. Women who smoke during pregnancy have a greater risk of miscarriage than do non smokers. Heavy alcohol use and illicit drug use also increase the risk of miscarriage. Weight. Being underweight or being overweight has been linked with an increased risk of miscarriage. Invasive prenatal test. Some invasive prenatal genetic tests such as chorionic villus sampling and amniocentesis carry a slight risk of miscarriage. Okay. Now let me tell you the complications. Some women who miscarry develop an infection in the uterus. This is called a septic miscarriage. Signs and symptoms of this infection include fever, chills, lower abdominal tenderness, foul smelling vaginal discharge. Okay. Now coming to the preventive measures. Well, often there is nothing you can do to prevent a miscarriage. Simply focus on taking good care of yourself and your baby. You should seek regular prenatal care. Avoid known miscarriage risk factors. Those risk factors which I just told you, such as smoking, drinking alcohol, and illicit drug use. Take a daily multivitamin as prescribed. Limit your caffeine intake. A recent study found that drinking more than 2 caffeinated beverages a day appear to be associated with a higher risk of miscarriage. If you have a chronic condition, work with your healthcare team to keep it under control. Now I'll tell you about the diagnosis. Well, your healthcare provider might do a variety of tests. The first is pelvic exam. Usually when patients come to us, we might check to see if your cervix has begun to dilate. Ultrasound. During an ultrasound, your healthcare provider will check for a fetal heartbeat and determine if the embryo is developing as it should be. If a diagnosis cannot be made, you might need to have another ultrasound in about a week. Blood test. Your healthcare provider might check the level of the pregnancy hormone, and that is human chorionic gonadotropin (HCG) in your blood and compare it to previous measurements. If the pattern of changes in your HCG level is abnormal, it could indicate a problem. Your healthcare provider might check to see if you are anemic, which could happen if you have experienced significant bleeding, and may also check your blood type. Tissue test. If you have passed tissue, it can be sent to a lab to confirm that a miscarriage has occurred and that your symptoms are not related to another cause. Chromosomal test. If you have had 2 or more previous miscarriages, your healthcare provider may order blood tests for both you and your partner to determine if your chromosomes are a factor. Possible diagnosis of miscarriage include threatened miscarriage. Now I am telling you the types of miscarriages. Okay. The first is threatened miscarriage. If you are bleeding but your cervix has not begun to dilate, there is a threat of miscarriage. Such pregnancies often proceed without any further problems. Inevitable miscarriage. If you are bleeding, cramping, and your cervix is dilated, a miscarriage is considered inevitable. Incomplete miscarriage. If you pass fetal or placental material but some remains in your uterus, it is considered as incomplete miscarriage. Miscarriage. In a miscarriage, the placental and embryonic tissue remain in the uterus, but the embryo has died or was never found. Complete miscarriage. If you have passed all the pregnancy tissues, it is considered a complete miscarriage. This is common for miscarriages occurring before 12 weeks. Septic miscarriage. If you develop an infection in the uterus, it is known as septic miscarriage. This can be a severe infection and demands immediate care. Now coming to the treatment. The first, I'll tell you about the threatened miscarriage treatment. Well, for a threatened miscarriage, your healthcare provider might recommend resting until the bleeding or pain subsides. Bed rest has not been proved to prevent miscarriage, but it is sometimes prescribed as a safeguard. You might be asked to avoid exercise and sex too. Although these steps have not been proved to reduce the risk of miscarriage, they might improve your comfort. In some cases, it is also a good idea to postpone traveling, especially to the areas where it would be difficult to receive prompt medical care. Ask your healthcare provider if it would be wise to delay any upcoming trips you have planned. Now I'll talk about other miscarriages. Okay, with ultrasound, it is now much easier to determine whether an embryo has died or was never formed. Either finding means that a miscarriage will definitely occur. In this situation, you might have several choices. The first is expectant management. If you have no signs of infection, you might choose to let the miscarriage progress naturally. Using this, usually this happens within a couple of weeks of determining that the embryo has died. Unfortunately, it might take up to 3 to 4 weeks. This can be an emotionally difficult time. If expulsion does not happen on its own, medical or surgical treatment will be needed. Now, coming to the medical treatment. Well, if you have seen my earlier video on abortion, okay, that is a medical abortion video. I have discussed the details of the treatment, and right now I advise you to see that video first. Okay. Okay. Now coming to the, but I will tell you a little bit in this video also. Well, coming to the medical treatment, if after a diagnosis of certain pregnancy loss, you would prefer to speed the process, medication can cause your body to expel the pregnancy tissue and placenta. The medication can be taken by mouth or by insertion in the vagina. Your healthcare provider might recommend inserting the medication vaginally to increase its effectiveness and minimize side effects such as nausea and diarrhea. For about 70 to 90% of women, this treatment works within 24 hours. Surgical treatment. Another option is a minor surgical procedure called suction dilation and curettage, that is D&C. During this procedure, your healthcare provider dilates your cervix and removes tissue from the inside of your uterus. Complications are rare, but they might include damage to the connective tissue of your cervix or the uterine wall. Surgical treatment is needed if you have a miscarriage accompanied by heavy bleeding or signs of an infection. Okay, well, this channel is basically created to spread awareness, because I'm a qualified doctor and there are so many unqualified people on YouTube giving you this wrong advice. So do not go for this kind of procedure with unqualified people. Okay. Now I'll tell you some little bit about physical recovery. Well, in most cases, the physical recovery from miscarriages takes only a few hours to a couple of days. In the meantime, you should call your healthcare provider if you experience heavy bleeding, fever, or abdominal pain. You might ovulate as soon as 2 weeks after a miscarriage. Expect your period to return within 4 to 6 weeks. You can start using any type of contraception immediately after a miscarriage. However, avoid having sex or putting anything in your vagina, such as a tampon, for 2 weeks after a miscarriage. Okay. Now I'll tell you about future pregnancies. Well, it is possible to become pregnant during the menstrual cycle immediately after a miscarriage. But if you and your partner decide to attempt another pregnancy, make sure you are physically and emotionally ready. Ask your healthcare provider for guidance about when you might try to conceive. Miscarriage is usually a one-time occurrence. Most women who miscarry go on to have a healthy pregnancy after miscarriage. Less than 5% of women who have two consecutive miscarriages, and only 1% have 3 or more consecutive miscarriages. Okay. If you experience multiple miscarriages, generally two or three in a row, consider testing to identify any underlying cause. Such causes could include problems with the uterus, blood clotting, or chromosome. If the cause of your miscarriages cannot be identified, do not lose hope. About 60 to 80% of women with unexplained repeated miscarriages go on to have healthy pregnancies. Well, this was my video about miscarriage. I hope you like this video. If you have any question about miscarriage, you can post in the comment section.